Welcome to Highland Hospital. This is the first of a three-part series of videos designed to help you get a running start before your first shift in the emergency department. Hi, my name is Cherie Hargis. I work with my colleague Dr. Caitlin Bailey to create this video, which can be used by anyone rotating through the department. However, you should also check the orientation guide specific to your level of training. In order to get started in the ED, you will need your ID badge and username and passwords for our electronic records. Outside rotators will need at least 8 weeks to get all the paperwork completed. The contact person is Karen Goodman in the Office of Graduate Medical Education. Interns and residents who are already affiliated with AHS should contact Jacqueline Alberto in the Department of Emergency Medicine about 6 weeks in advance. We will also be asking you to set a series of goals for your rotation. Our basic expectations are that you will be professional, punctual, and will be diligent about completing your charts. But it's really important to emphasize that you present each of your patients to the attending, that you alert the attending if you have a patient who has unstable vital signs sooner rather than later, and that you sign out every patient that you have before you leave the department. The emergency department shifts and shift changes are listed as follows. Your schedule will depend on whether you're a medical student, intern, or resident. Please refer to the orientation guides. If you know you are going to be late, or if you know you are going to miss a shift due to illness or an emergency, please call the on-duty attending and let them know what's going on. Otherwise, you will have an unexcused absence, which will adversely affect your evaluation. Unexcused missed shifts must be made up for full credit. After your third shift, you should begin to hand out cards to the attending or supervising resident that you work with during that shift. Keep a record on the back of what the patient's chief complaint was or any procedures. Do not use birth dates or medical records. Medical students use blue cards, interns and residents use pink cards. The Department of Emergency Medicine has a Wednesday conference from 7:30 to 12:30, and we would like the residents and interns to begin to attend at least one of these. We also have on the third Thursday a follow-up conference and journal club. Medical students are having didactic sessions every Thursday from 12 till 3, and there's a schedule, and if there's any topic which interests an intern or resident, they are also welcome to attend. We also have daily GI rounds, and these can be cases, sometimes they are procedural, but they are mandatory for anybody on the shift. Be sure to check out the highlandultrasound.com website. We also have some procedure PDFs in Evernote, and we have an article file. 3 useful practices to maintain safety include being aware of your surroundings at all times, using hand hygiene prior to a patient encounter and after, also before meals, and using appropriate personal protection equipment before procedures. In the event of a needle stick or mucosal exposure, stop the procedure or have the supervisor finish it. Wash the affected area with soap and water if it's a needle stick or rinse if it's mucosal. Tell the attending and we will initiate the post-exposure protocol. When you hear overhead announcements for medical codes or trauma activations, please come to Station 1. Please pay attention to other overhead announcements such as Code Blue or Code White. This is a medical situation for an adult or a child. The residents will be responding to these codes, and you may go with them if your patient is stabilized. If you need to call security, the number is 55555. Code Gray indicates a combative person. A Code 10 is a situation where a patient's been dropped off in the horseshoe. Allow law enforcement to stabilize the situation first. If you hear an overhead announcement for a code gray, silver, or tan, note the location and actively avoid it. Let the deputy secure the situation. Code reds or fires, stay tuned, note the location. Code pinks indicate child abductions. You will not be able to use the elevators or the stairwells. Please actively respond to ED medical codes and to traumas. The last safety issue covers proper waste disposal. Biohazardous materials should be put in the red biohazard containers. If there is a sharp object, please put it in the sharp box. This is important for the safety of everyone. Well, we've covered the preliminaries, and now it's time for your first shift. Come down to the emergency department and introduce yourself to the attending. You have your ID badge and your usernames and passwords, right? The ED attending or the supervising resident will make sure that you are able to log on to Wellsoft and may assign you your first patient. You may have to use our language sources in order to get your H&P done. We use Wellsoft. Be sure to log on and log off every time you use the terminal. If you have questions or if you need help, just ask. Ask an attending, a resident, a nurse. Everybody is willing to help you. Just ask. When you first pick up a patient, please note to their vital signs. Let the attending know if any of the vital signs are abnormal or if the patient is in severe distress. The attending will come to the bedside to assess the patient immediately. Before you write up your chart, you must present to the attending. Before you do that, please take a few moments to gather your thoughts. You should have a focused, succinct history and physical which contains pertinent positives and negatives which support your top-tier differential. After the discussion with the attending, you can order labs and studies. Medical students must present to the attending before any studies, labs, or treatments are ordered because the attending has to place the order. Attending will help you decide whether a consult is indicated or whether admission is needed. Please discuss the case with the admitting resident if this has been approved by our attending. At change of shift, we are going through over 44 patients or more. So each presentation needs to be very precise with an updated clinical situation and plan. Before you leave your shift, you must sign out each and every one of your patients. So find a new provider, write an update note, and be sure to document the name of the person you signed over to. The new provider will then assess the patient and make their own brief update note and indicate that they received the patient from you. You will do a lot of ultrasound exams while you are at Highland, but you must have an attending or supervising resident present during each exam. Please show a little TLC for the ultrasound machines. After you are finished with an exam, return them to their charging docks and clean the probes with the disinfectant wipes. Used endocavitary probes are returned to their cases and then are placed in the Station 3 dirty utility room. Before you do an invasive procedure, you need to have discussed this with the attending or supervising resident. The resident or attending must be present during the procedure, but you are responsible for setting up during the procedure, cleanup, carrying the critical specimens to the lab, and writing the procedure note. This concludes part 1. In summary, we want you to be ready from the start. We want you to alert the attending for any unstable patients, present each patient to the attending, and have a supervisor present for all procedures. We also want you to sign out each of your patients before you leave the ED. We look forward to seeing you soon. We want you to have fun, we want you to learn a lot, and we want you to be safe. Please continue to the next 2 videos in this series.